So good afternoon, everyone, and thank you so much for joining us. My name is Tammy McLeod, and I am the President and CEO of the Flynn Foundation. And I'm really pleased to welcome you all to this webinar on behalf of the Flynn Foundation, the Arizona Center for Civic Leadership, and our colleagues at the Arizona Community Foundation and the Black Philanthropy Initiative. This webinar is part of our CivEx initiative. CivEx stands for Arizona Civic Engagement, or Civic Exchange, and it's designed for all Arizonans who want to be more involved in civic life. 2020 has certainly shown us that there's an urgent need for deeper engagement, for dialogue and understanding around our community's greatest challenges. And today we're focusing on the work of the Black Philanthropy Initiative. This is a permanent endowment at the Arizona Community Foundation that advances equity, leadership, and social justice for African Americans. Today's speakers are some of Arizona's most important leaders, scholars, and philanthropists. And among them, I'm proud to say that we have two Flynn Brown Fellows, Taniqua Broughton and Gail Knight. I hope that you'll take away from this time with them today a desire to learn and engage even more. And you will have that opportunity next month, which is Black Philanthropy Month. BPI will present a four-part series, Foresight 2020, on social justice, and it will be open to everyone. I just want to point out, if you haven't had a chance, it's hard to see, but today is the last day to get your ballots in, if you haven't done that. And now I am so pleased to introduce my friend, Kim Covington. She's the Senior Director of Community Initiatives at Arizona Community Foundation, and she leads ACF's work to build community collaborations across Arizona. Just before Kim shares the history of the Black Philanthropy Initiative, I'd like to share a couple items of housekeeping. Today our session is being recorded for all of us, and you have all been placed on mute, but we hope to see an active chat box down below for your questions and your comments during this session. So now I'd love to turn it over to Kim.
Thank you so much, Tammy, for giving us the opportunity to share the history of the BPI, or Black Philanthropy Initiative, the urgent need to support it, and provide a space for the Flynn Foundation and the Flynn Brown Fellows to expand their knowledge and help address inequities among African Americans in Arizona. Before we share what BPI is, let us explain why there is a need for BPI. For the next 45 minutes, we will take a closer look at just two of the issues where we will see some of the greatest disparities in the Black community: education and healthcare. While no community has been spared by the current public health crisis, COVID-19 has taken a disproportionate toll on the physical and economic well-being of African Americans. To learn more, please welcome the following members of BPI: Banner Alzheimer Institute and Banner Sun Health Research Institute research nurse Dr. Angela Allen, Equality Care Center's medical director Dr. Edmund Baker, and longtime Phoenix pediatrician and owner of the Wooten Health Group, Dr. Dwayne Wooten. Good afternoon.
Good afternoon. This presentation will be a mix of science and social commentary. And as we advance to the next slide, Dr. Allen will discuss statistics as related to COVID-19.
Very much, Dr. Baker. And before we get into specifics on COVID-19, I know many of us are familiar with what's going on as it relates to this pandemic. So I'd like to share a little bit of information on the current statistics as it relates to COVID-19. As you can see on the slide, we have, as of July the 20th, and actually we're looking at even further until about a week from now, which is actually the 29th, our numbers worldwide is about 14 million, where there's identified as over 600,000 deaths. Now, just to give you an idea of how fast this number is growing, we are currently looking at over 17 million within 1 week, and almost over 200,000 per death as it relates to worldwide. In the United States, we're looking at about 3 million. As you all can just imagine, this number has increased to over 4 million. And just to give you an idea, that's 1/4 of worldwide numbers when we are looking at particularly new cases. And in Arizona, and this is where we are currently, we're actually identifying on the 20th, we had a total of about 145,000 current cases and over 300,000 deaths. Whereas of today, we have topped that to identify the number of people who have been confirmed with COVID-19 to over 165,000 confirmed cases. Just to give you an idea, that's over 20,000 cases, increased cases just in 7 days, where we're also looking at over 300,000, and to be more specific, 3,300 cases as it relates to deaths in Arizona. Next slide, please. Now, when we look at the numbers as it relates to African Americans, and this is deaths per 100,000, and we adjusted it by age. That adjustment by age is particularly looking at the large number of people who have been identified with having COVID-19 as of July the 20th. In the United States, as we know, it was about 94 out of 100,000 people who are African Americans who have been confirmed with having some relationship to COVID-19, compared to our white counterparts of 25. In Arizona, 29, whereas our white counterparts having out of 100,000, 17 of our white counterparts. Whereas we look at our high numbers in Mississippi, Michigan, and Louisiana, we see that there's a significant high number of African Americans who have been impacted by COVID-19, whereas we look at our white counterparts, those numbers are significantly lower. Our next slide, please. Then when we move to our statistics as it relates to deaths per 100,000, again, these dates are as of July the 20th. We look at the Latin American, there's about 62 versus their white counterparts, 25. In Arizona in particular, and this is because we have a large percentage of Latin Americans, there are 39, where our white counterparts 17. In Texas, 14, which is what we consider Arizona and Texas a hot spot, and our white counterparts 6. Native Americans, we have a number that we really can't identify because their testing obviously is located more in our central Phoenix area. And we do know that in the tribal area, we're not able to get a specific number. So we do identify that as an irrelevant number, if you will, but we do have high numbers. But in particular, in our Arizona area, we have 187 compared to our white counterparts of 17. And again, this is particularly in Arizona. Next slide, please. So when we look again on July the 20th date, we're looking at our number of deaths, rates per race as it relates to ethnicity. And our non-Hispanic whites, about 39% as it relates to COVID-19 deaths, Hispanic, 26%, Native American, as we've identified, this number is a number that we really can't pinpoint, but we're looking at 14%, and African Americans 3%. But keep in mind, our African Americans, as it relates to the number of African Americans in Arizona, is about 3%. Our Asian, 1%, non-Hispanic, other, 2%, and the significant high number of unknown is because when we began our testing, we did not identify specific race or ethnicity. Thank you. Next slide, please.
Thank you, Dr. Allen. For everyone on the call, this is a cartoon depiction of the virus. Its name is SARS-CoV-2. It has never been seen prior to December, and it belongs to a family of viruses called coronavirus. They were named this way because of their crown-like appearance when looked on the electron microscope. Coronaviruses usually cause really mild disease and infections. However, some of the cousins of this virus, like the original SARS virus from China in 2002, and the MERS virus in 2012, which came out of Saudi Arabia, those two were significantly more severe. The disease that's caused by this virus is COVID-19, which stands for Coronavirus Disease 2019. Next slide, please. So the general population is beginning to see that racial disparity is real and has huge negative impact on health outcomes. The slide to the right shows how medical disparity plays out in neonatal mortality. As you can see, African American babies were 38% of this county's population. However, 71% of the Black babies that died each year was vastly disproportionate to its counterpart. And you can see on the slide to the left, where you look at all men having a lifetime chance of being incarcerated of 1 in 9, African Americans are 1 in 3 compared to the white counterparts at 1 in 17. And it just shows how judicial disparity plays out disproportionate incarceration of Black men. Next slide, please. So this pandemic came out of nowhere. And in the words of Mike Tyson, everyone has a plan until they get punched in the mouth. And the United States was touted as the world leader in medicine before COVID-19 came. This virus exposed many of our healthcare deficiencies, and we were not ready for the viral pandemic when it got here. And because we never addressed the previous pandemic of chronic illnesses in the underserved communities. Next slide, please. This is a very important slide because a lot of people, even though we're well educated, don't get the differences between equality and equity. So in healthcare, equality means that everybody gets the same thing. In other words, I toss out medicine to you, you get better. That's my interpretation of how everyone gets the same thing. However, equity in healthcare means that people need to get what they need to achieve their best health. In other words, it means removing barriers to care. It could mean providing transportation, reducing costs to my visits, and even working longer hours to allow that working mom an opportunity to see me in hours that are not favorable to her as she's working. Next slide, please. So while there are more than 80% of the, people infected with COVID-19 will have mild to moderate disease, get better, and it'll never be an issue, the early publications noted that there was a subset of patients who were having worse outcomes. And these people were the older, those older than 60, 65 years old, chronic illnesses as noted, and also those that are immunocompromised. And I just want to note that I put an asterisk next to cancer because it's not cancer patients who had cancer in the past. These are people that are being treated for cancer and have really low immune systems. Next slide, please. So hearing that, I became worried, right? Because I knew African Americans would be more adversely affected because of the disproportionate higher heart disease, lung disease, and diabetes as noted on the slide. But please, let me tell everyone on this call, this is extremely important. Poverty is a public health issue. So medically, we have an immune system, right? And we fight our infections from within our body, but our social determinants of health, those are things like education, economic stability, healthcare, neighborhood construct, right? Social construct. These all have a clear relationship with respect to health outcomes, including elevated risk for premature death. And often members of marginalized communities have jobs that don't translate well to virtual substitutes like transit workers, those that work in other high-touch environments. And social distancing is difficult in homeless shelters, close-quarter housing, and the prison systems. So we need to work better to have more protocols in place to ensure that everyone is safe. Next slide, please. So there are many studies out there to try to understand why is it that African Americans and other people of color have worse outcomes, even after accounting for social determinants of health. And I want to give you guys a word. It's called race-based trauma, all right? And this is a stress injury born out of exposure to racism. Now, it's important to note that racism is not just overt, like the obvious harassments and discriminations. In fact, in my belief, it's the most insidious forms of racism, which include microaggressions, the systemic factors that are woven into our, what we consider normal societal construct. These all play out in healthcare when a provider knowingly or unknowingly has implicit biases towards a patient. Next slide, please. So when this stress hormone, which is called cortisol, is elevated, it leads to elevated blood sugar, blood pressure, suppressed immune system. And this happens because, as a human, when we see a tiger, we expect to have our stress elevated, think more clearly, more blood sugar to get to our muscles, blood pressure to allow us to think better. This is all important in this situation, but this is not supposed to be a chronic type of situation. Elevated cortisol, when chronic, leads to disease. Next slide, please. So improving our outcomes is very important that we continue best practices out there. So when you see people walking around with no mask, this is not where we want to be. We want to make sure we're washing our hands. Even though the stay-at-home initiative won't be extended to everyone, please use it for your close circles, for your family. We need to improve the stream of education. Now, just talking to people like me talking to you is no good if it's not culturally competent. In other words, made so that everyone at every level can understand it. And also, we need to improve our resources, such as community testing, which we've been doing, contact tracing, which we've not been very good at, and increasing our community partnerships with groups like yourself and us. And we need to limit exposure in the community. I would like to now have Dr. Wooten to come on this next slide and talk more about inequity.
Can you hear me now, everybody? I know that I am going to sum this up in the best way that I can sum up that everybody, all these very intelligent Flynn Foundation fellows will understand, because I'm dealing with a group of people that have such high IQs that I don't have to go into great detail. You've been shown some slides that show a significant amount of disparity. And the one thing that I want you to take home with you more than anything else is the fact that we are a stressed society. We're more stressed now than we've probably been for years and years and years. And the main reason I have this slide up, I'm going to show you a group of people in a far, far place known as Fiji. Those are Fijians that welcomed myself a few months ago to the island right before COVID hit. Next slide, please. That's the view that I had while I went to work on my stress. Now, why is that important? Because in the island of Fiji, where there are almost 1 million inhabitants, 962,000 at my last look, they had a total of 28 cases of COVID-19 and 18 resolved within a matter of a couple of weeks. Their mortality rate was almost zero. And you may want to ask the question, why? This is a third world area. This is a place that they're medically inadequate. You would never fly to Fiji to get your cardiac transplant, correct? Well, it's a thing called stress, because their stress of day-to-day living is zero compared to our stress of day-to-day living. And so Dr. Baker just showed you slides talking about cortisol, but I want you to understand something. If we don't do something to help with the healthcare disparities, the fact that there are people who work every day of their lives wondering where they're going to eat the next day, how they're going to feed their children the next day, we're going to always have these significant healthcare disparities. And where you as individuals who are very into the Flynn Foundation and what someone like the Black Philanthropy Initiative is trying to do, how can you help that? Is by supporting those organizations that support community organizations that take care of adults and children who have been manifested in this healthcare disparity wheel. I will have to tell, I just have one statistic to let you know. About 10 years ago, we looked at deaths in America. The average Caucasian woman lives to be 78 to 79 years of age. The average Caucasian male, a year and a half less than that, about 76 to 77 years. The average African-American female lives to be 72 years old. The average African-American male lives to be about 70, 69 and a half. But you want to hear a very interesting statistic? average African-American male physician lives to be 58 to 59 and a half years. And I want you to think about that. How is that possible? And I think it has all to do with the fact that we went into medicine so that we could try to fix all these inequities that we see and we've lived with all of our lives. And I'm sad to say, many of these inequities that you're hearing about today have been existent for the last 40 to 50 years that we've been talking about since then, and we've seen very little change. We cannot call ourselves the greatest country in the world when we're number 32 on the list of infant mortality. I think you saw a slide earlier that spoke about we rank less than most third world countries in infant mortality in this country, the United States of America. When third world countries outdo us, there's a problem. And so our goal is to fix as many of these inequities as possible. Our goal is to reach out to people like yourselves and show you these statistics so that you will have a passion to try to assist in this process. And so I appreciate your time. Go to the next slide. And those are my feet looking at that view, and my stress level came down. So I thank you again.
Well, thank you, team. We're going to bring in Dawn Wallace now. She is Vice President of Civic Leadership at Flynn Foundation, and she's been monitoring all the questions. Dawn.
Thank you, Kim. We have a question for Dr. Baker. When you say improve the stream of education, are you referring only to healthcare or overall?
Well, this is overall. You know, my wheelhouse is healthcare as well as cultural. So I think, you know, very soon you're going to hear about education. We need to be educating our teachers, our physicians, and all of these professions on the implicit biases. And we also need to be teaching our community about these diseases so they don't learn it from Facebook. And we have to be able to reach them at community levels, at grassroots level, and not talking down to them. We need to be in their churches, in their community centers, in their mosque, talking and educating from that point of view.
Thank you, Dr. Baker. Kim, we don't have any more questions left for this segment, so I think we can advance to the next, where we'll be featuring two amazing fellows in our Flynn Brown network. Thank you.
All right. Thank you, Dawn, and thank you, doctors. And now, with more on education inequities, here are BPI members and Flynn Brown Fellows, Boggs Elementary School District Governing Board member Gail Q. Knight, and founder and executive director of the State of Black Arizona, Taniqua Broughton. Good afternoon.
Good afternoon.
Good afternoon. And thanks, Kim, for the introduction. Greetings, fellows. This presentation today will serve as a quick snapshot on a number of educational inequities for students of color in Arizona. Of the 1 million plus students in K-12 education, 50,000 of them identify as Black, African American, which mirrors about the same percentage of the general adult population in Arizona. What is important to know about these educational inequities is that the inequities are not new to education, and especially for students of color or Arizona. Consider that these challenges have been exacerbated already issues even more due to COVID. So here are a few national digital divide statistics on students of color from the Pew Research Center. So 3 million households with school-age children do not have at-home broadband. And about 2 million households rely exclusively on cellular networks to access broadband. So when we think about the virtual learning opportunities, we've actually widened that homework gap. Students of color face less access to school, be unable to access those materials. So when you think about it, 13% of white teens said that they were unable to access materials versus 25% of African American students. And acknowledging that 25% of African American students and our demographics, even here or across the country, it potentially is disproportionate in many communities. And these are just a few of some of the challenges that have arose since we've gone to virtual learning. On the slide in front of you, we've outlined 5 inequities in education. And you can see we have a disclaimer that not all these issues cross public and private education and affect all students and teachers in Arizona. But I want to share, in about almost 2 years ago, through a partnership with the Greater Phoenix Urban League, the state of Black Arizona started working to create awareness and drive accountability on our equity needs for students and teachers throughout the state in a collaboration with the Arizona Department of Education. You have heard of the Every Student Succeeds Act, most known as No Child Left Behind, which is the federal mandate on how students should learn in schools. What you see on this slide, the National Urban League Equity and Excellence Project identified 12 equity indicators that provided accountability markers on how we were performing as a state in these areas for our students and teachers. There's so much that I can dive into about it around the assessment, but we look forward to an opportunity to discuss these inequities more in a bigger series and bigger platform. We want to utilize you as our allies of this website, of this webinar, to address these systemic issues. I want to thank you for your time and the opportunity to share our insight. Gail Knight, our other fellow, will share some data and perspective about lack of teacher representation, a number of other inequities, and implicit biases that are happening in education. Next slide, thank you.
Good evening. In 2016, the National Black Education Association announced at the Congressional Black Caucus Conference that we as board members need to be focused on the change of population among teachers in our elementary schools, because it was the year of the beginning of the retirement of many African American teachers across the country in public education. You move to the next slide, please. We realized in 2018 that we were certainly losing a lot of African American teachers, and the Federal Department of Education began to make reports on how overwhelming the decrease was. Teachers of color only represented 18% of educators, and Black male teachers just 2%, while approximately 49% of public elementary and secondary school students are children of color. Followed by that, the Arizona Republic reported on the population that was beginning to divide here in the state among our public education and charter school students. Next slide, please. In Arizona, 3 out of 4 teachers are white, while 15% Hispanic, 46% of the students are Hispanic, 2% of Native Americans, 4% of students are Native, 4% of African American Black teachers, 5% of students are Black. And while 75% of the students are white, teachers are white, 38 students are white. The number has begun to continue to grow because we do not have enough new and interested students coming into education. And we are concerned about the impact it has on our school districts, specifically one like the one that I am in, that has a population of 90% of children of color and 93 to 94% of teachers who are other than of color. We want to look at a diverse teacher pool. We want to make sure that our children are having the opportunity to see those role models and to begin to have a feeling of belonging in their local schools. Next slide, please. Researchers found, and this was in the US News and World Report in November 2018, that when a Black teacher in kindergarten has an opportunity to interact with a kindergartner, that young man or woman will have a desire to attend college. Even further than that, if two teachers that are in their lives in elementary school are African American, not only will they want to go to college, but they will also seek out scholarships to do so. Researchers at Vanderbilt University found that Black students with high standardized test scores are less likely to be referred to school gifted programs. Black teachers were more likely to refer the Black students to gifted programs. And I have to honestly say, in working in the school district, these are not just figures on a page with no actual experiences or incidents in which these things have happened, because they have, unfortunately, where even parents will send in complaints or come to our board meetings and speak to the fact that they do not feel that their students are getting all of direction and motivation and encouragement to succeed. Next slide, please. So we had, at the Arizona School Board Association, began to address the issues of inequities in teacher representation. How can we begin to change and close that gap and increase teacher representation in our school districts? We're asked our association staff to spend time with the school board across the state of Arizona to look at some of the recommendations we have put forth and begin to work with us on achieving them, like establishing partnerships with our high schools and colleges to promote teacher and administrative careers in education. And we say administrative careers, we're talking about principals and we're talking about superintendents, because it starts from the top. No matter how many teachers you have in the school district and the individuals that are there, the superintendent has a lot of impact and a lot of influence on who those teachers are. We want to develop and implement strategies for increasing Black teachers, principals, and superintendents in schools. How do we reassure, without our superintendents feeling tremendously pressured by their school board members, to begin to increase people of color in teaching administration? We want to include training that focuses on implicit bias and cultural competence for our teachers that are currently in our school districts. And we also want to provide that training to those individuals who have decided to cross over in their careers, leave engineering, leave administration in the public sector, and become a teacher, because these individuals need that training also. And with Governor Ducey recently providing the opportunity for emergency certifications, we have just a combination of individuals in our school districts who have not had what we consider appropriate training to be working with our kids in the system. We need to address that and make changes there. We want to develop and provide training for our governing school board members, who themselves may not even notice or pay attention to or think it is anything that they need to be concerned about as it relates to implicit bias and cultural competence. But we also need to come together and talk about our own personal experiences in attending public schools and why we were successful, and make sure that we are putting those same practices in place for our kids now. We want to close the achievement gaps that continue to increase overall. And we want to truly get rid of suspension rates. And we feel a need to really focus on those strategies, bringing in those individuals that have the experience, that are professional in that field, that can give to us best practices, that can come in and do training and hands-on with our teachers and our principals, and even sometimes the superintendent, to understand how to best address those issues. We feel that if we do this, we will create a balanced workforce at our schools representative of the population that it serves. That you won't walk into a school and see 99% almost of students of color, and you have to search for a teacher of color. You have to search for administrator or superintendent and wonder how in the world did this happen? And then you look around at the board and see, oh, okay, not even the board represents the population of the school. So it's critically important that we feel as we move ahead in education and help our kids to achieve success in education, that we need to be focused on these issues. And I need to say that the current situation with COVID is bringing another challenge to make sure that we're able to address equity and bring about those changes that will be needed. We have this goal of do no harm, but we have to truly define what do no harm means when we're grading, when we're looking at how we're going to create study sessions, how we're going to create learning opportunities, how we're going to make sure that curriculums and teaching are continuing to provide the work and the knowledge that our kids need in our public education system. Thank you.
Well, we have a lot of questions coming in. Dawn, you got them?
You bet I do. So first we'll start off, and I think we'll start with you, Gail, since you were talking about the lack of representation in our teacher corps. We have a question from a fellow who says, how can we encourage students of color to join the teacher prep programs to begin changing the numbers of teachers that we have in our school classrooms to those of teachers of color?
It's an interesting question you asked. I was just a part of a roundtable last week, and that was the very subject of how do we begin to promote teaching among our students. There have been a lot of recommendations given, but we are calling on experts from Stanford and Harvard and Vanderbilt. Vanderbilt has had a very successful track record in encouraging young people to focus on education and to apply to their school. And I think one reason why Vanderbilt has always had a large core of students, not only white students, but students of color, is because that they truly go out to the schools and they talk about the importance of becoming a teacher and inviting them to consider Vanderbilt. And during the time that my daughter attended Vanderbilt, they were giving full presidential scholarships to students and becoming their coaches and their mentors throughout the time that they were at the schools. So we're looking to see how many other programs are similar to that, what universities and colleges are doing to expand and increase the amount of young people, specifically people of color, in education, to come up with that plan of action that we feel that we can implement out there in the general public.
Thank you so much, Gail. Taniqua, this next question is for you. You talked a bit about the digital divide. We have a question from a participant that says, with the digital divide's negative effect on access to internet-based learning in the communities of color in Arizona, where do you stand on the issue of bringing children back to school for in-person classes this fall? There's actually several questions around the, the thought around bringing children back, specifically around that digital divide.
So Don, I'm gonna answer this from my perspective. I'm also gonna use a funny quote I like to say I learned in my class that my fellow classmates would say is, this is a little bit maybe above my pay grade, but I say that in love, in the sense that more than education happens at school for students. And so while I would love them to go back to the classroom, and I have laid out a lot of the digital divide statistics, I myself align with what health professionals are sharing, as well as some of the CDC guidelines. So that's how I am going to respond to that, because ultimately I may want them back in the classroom, but if it's not safe to go back into the classroom, yes, these inequities continue to be in our face. But what I think is really important is, what are we doing collectively also to still address it without just walking away, even though our children are not in school at this time.
Thank you so much. Gail, this next question is for you. Is there a partnership with community colleges to increase interest and capacity in teacher representation? Are you familiar with any programs that are out there to do that?
There are programs like that. I know ASU has a huge partnership with most of the schools in Arizona on working with improving on the preparation as well as participation of young people in education. But one of the discussions that we're having with ASU, again, is while we want them to come, we want them to be excited about being teachers, they need to not only have the foundation of teaching and learning, but also the other cultural needs that they must have in training as well. Because we want to make sure that we're not taking them in because we have the lack of numbers, but we want to take them in because they are fully 360-degree trained to be a teacher. They need to understand that communities are not like they used to be, and the population that they will be serving will be nothing like what they may be seeing in their colleges. But there's an opportunity that even though there are internships involved, the internships will also include a focus on learning more as it relates to implicit bias, learning more as it relates to cultural competence, learning more as it relates to different students' teaching styles, so that when they do make that transition, they are ready to be in those settings and work with children in public education.
Thank you. We have a lot of questions, so I'm trying to combine a few together that have similar themes. And we have several questions around how education funding creates more gaps in achievement for children of color. And this is for both of you to answer, can you share a little bit about your thinking on that, how we fund schools in the state of Arizona, their reliance on local property taxes, and how that affects the education and success of learning for our children?
Oftentimes, individuals think that it is just the property taxes that fund the local schools, but there are many different pockets of money on the federal level that Trump, thank God, has not closed away and not have them available for us anymore. So there are different title fundings for various needs of students, where actually if you have, and I have to honestly say this, if you have a competent superintendent that is aware of the types of funds that are available out there, those gaps can come to little to nothing at all if that is the type of individual you have in that position. The superintendent plays an extremely important role in ensuring that those grants are there, those funding sources are there for the needs that you identify for your particular population. And if they're not, or if they're really not concerned about that, then that begins the gap. But if they are ones that make sure that they are covering every inch of the needs of their kids, there is quite a bit of money out there. We have a new superintendent in our school district. And when she came on board, she looked at the dollars that we had, and we thought that we had so much that it wasn't a need for her to look at any others. And she pointed out two more that we had not taken advantage of that we need to consider for our school in an area where we really and truly need it. So that resource and that knowledge is important to ensuring that you fill those gaps that are constantly talked about among kids of color, that there's not enough money there. The not enough money isn't there if you haven't done the appropriate research to identify those funds. And being one that is a professional fund developer, I know that if you do your research right, you can find those dollars to achieve the goals within the school system for your kids.
So we have a lot of questions for Taniqua and Gail, and I think we need to create another opportunity where our fellows get more time with you to talk about the issues in education. But we're going to move on to Kim and Devontae and their discussions around the work that's happening at the with the Black Philanthropy Initiative at the Arizona Community Foundation. Kim, do you want to take it away?
Sure. Thank you, Dawn. And thank you so much, Gail and Taniqua, for your work. We all make a great team, don't we? Just love that you have such expertise in this area. We just shared two of the many issues created by systems of oppression. As we celebrate the life and legacy of Representative John Lewis, who got into good trouble working to dismantle them, we also know that more than 12 years ago, the Arizona Community Foundation met another civil rights leader making good trouble. Board member and philanthropist Jean Fairfax, who passed away last year, called on staff, board members, and community leaders to improve equity and outreach by developing the Black Philanthropy Initiative. ACF is the state's largest grant maker and private provider of scholarships, with a mission to lead, serve, and collaborate for a better Arizona. And we won't rest until there is a better Arizona for all. So here's Abbott Downing investment analyst and BPI chair Devontae Davis with more. Devontae?
Oh, there we go.
Can you hear me now?
Yes.
Sorry about that. Thank you, Kim, and hello to all Flint Brown fellows, scholars, and participants. BPI and its collaborative funds help improve equity through philanthropy by targeting grants to those Black-led organizations that are closest to the problems and providing race-conscious solutions. Next slide, please. The same strategy is used for the Black Philanthropy's two giving circles, the African American Women's Giving and Empowerment Circle, which is shown here in their photo of their civic engagement at the Flynn Foundation, and the Men's Giving Circle, Real Engagement for Active Philanthropy, or simply REAP. Next slide, please. Since 2015, BPI and its giving circles have awarded nearly $250,000 in grants to nonprofit organizations serving the African American community, addressing all of the issues that our education and medical experts illustrated today. Most recently, over the past few months, Black philanthropists in the Valley have worked together to award over $40,000 in COVID relief for testing, food boxes, and small business counseling. BPI has supported an additional $10,000 in mini grants for these nonprofit organizations for COVID-related supplies, rental assistance, food, and transportation. Next slide, please. BPI donors provide monthly giving and produce two major events each year to generate support and awareness, those being the Let's Make History Together event in February and the Black Philanthropy Month event in August. Along with our general collaborative fund, we have established an endowment, an education fund, and then last year we established a social justice fund, which encourages corporate and individual donors to support nonprofits whose goal is to improve social justice and equity. More so, these grants will support economic equality, especially in areas of business and workforce development, to help build wealth and opportunities for African Americans in Arizona. That said, BPI can't change the decades of inequalities alone. It's going to take greater investments by all, so we invite all attendees to listen, learn, act by joining us at our Foresight 2020 All Eyes on Social Justice event. It's an online webinar series of virtual conversations every Wednesday at 6 p.m. in August. Thanks.
Thank you so much, Devontae, Gail, Taniqua, Dr. Allen, Dr. Baker, and Dr. Wooten. Dawn, do you have any more questions for us? I know we have about 5 more minutes of this webinar. Time goes by fast, doesn't it?
It sure does. I think we have a really good question that will sort of encapsulate all of the discussions that we've had today with our panelists. And I think I open this up to anyone who wants to answer. The systemic disparities across healthcare, education, economics, criminal justice are vast, and there are intersections between them. Are there any discussions for addressing holistic issues? This question came from a governing board member of a school district in the West Valley, and she's observed that there's been a bit of a lack of interest and understanding amongst leadership in our institutions of education around how bias affects students. What can we do to look at these issues holistically?
Well, I can answer one of those questions from the ACF side of it, and then I'd like Taniqua and Gail and Dr. Edmund Baker and Dr. Allen and Devontae to maybe chime in. We have a platform at ACF called the Courage to Listen, Learn, and Act. And we believe that, bringing in the community and addressing some of these issues that's really a great way for people to learn. And for the last couple of years, we addressed mass incarceration, school to prison pipeline, all of that, and how that impacts education and our healthcare. And then next year, we're going to be addressing affordable housing. So those types of workshops, intimate discussions, conversations, great way for the community to learn about some of these systemic issues. Anyone else have anything to add?
I would certainly recommend from the types of activities that are going on at ACF, if you're not on their mailing list, to please get in touch with Kim so you can get on the mailing list, because certainly these discussions are leading to more and more individuals and groups coming together and focus on taking action for change and bringing in individuals that have the knowledge to assist and help with those particular type of needs to occur. So if you're not on our mailing list at ACF, please contact Kim to make sure that you are.
And you've got to participate in the webinar, right, Gail? Next week, Foresight 2020 is going to address all of this.
So we have 116 participants on this call, of which I am included in this number. And if you ask me, how many people have implicit biases, it's all of us. And it's the fact that we are unaware of our biases, that's the problem. When you are aware of biases, and whether they're good or bad, whatever that may mean, when you're unaware is detrimental. When you're aware, you can actually do some good to help. So it's about that education, about being aware of your biases and how to work around them.
I'd like to also piggyback what Dr. Baker stated, as well as Gail. One of the things that we have to recognize is the fact that not only are we aware, we have to be willing to actually gain knowledge and actually receive knowledge. And not only do we have to gain and receive knowledge, we also have to identify the skills that we lack as it relates to the unawareness. But more importantly, one of the things that we're doing, and I work for one of the largest healthcare systems in Arizona, we are doing that now, but we've taken it a step further. We are now beginning to apply the knowledge that we have gained in our clinical setting so that we can better serve the population that we see the most.
And then I'll jump in as far as I consider my role at the state of Black Arizona when we are trying to collect data. When I think about in the state of Arizona, there are not a lot of organizations that are aggregating or disaggregating the ability to be able to disaggregate data for us. And so what I found being really hard for us is if we're going to make decisions around data, if it is about data informs our decision making and the African American community has not even been aggregated in there, that makes it really hard. And I think sometimes that implicit bias of us being forgotten is a part of the challenge as well. So one of the approaches I'll share that we are considering, or we are in action with, is with CFA, the Center for the Future of Arizona, where their progress meters, 5 of the 8 can be disaggregated by race. And so if we're moving forward in making sure that we don't forget marginalized groups, people of color, issues and concerns, we have to make sure that all these opportunities when we're making decisions around data are available and at the table. So we need everyone to be allies, to speak even on our behalf times when we're not at the table.
So Dawn, as you can see, we have a deep bench at the Black Philanthropy Initiative. BPI informs ACF's philanthropy, and it informs the community. And we are asking you to trust these experts. They are in the community. They are listening to the community every single day. And what they've gathered and what we gather in the community, that informs our grant making, and then we provide that support for our community. And we invite you to invest in BPI, and Devontae is going to be sharing more about this next week at our Foresight 2020, correct?
It is correct, Kim. And I think the theme that everyone can see here is educating and bringing awareness, and that's exactly what BPI is here to do, especially next week during the next month. All of August is the Black Philanthropy Month, and we plan on just educating the community. I know a lot of individuals feel a sense of guilt when these types of conversations do come up, but it is definitely our mission is to bring education and awareness.
Well, with that said, Dawn and Tammy, we really appreciate the platform. Thank you so much for allowing us to share our story and these inequities in the Black community.
So thank you, Kim. And on behalf of the Arizona Center for Civic Leadership at the Flynn Foundation, we would very much like to thank our panelists, Dr. Baker, Dr. Allen, Dr. Wooten, for your incredible insights, and our amazing fellows, Taniqua Broughton and Gail Knight. Thank you so much. We want to let you know that we will be sending out an email to all the participants with a link to the registration for the Foresight 2020 webinar series that BPI is sponsoring. And I will close with a thank you to the amazing Kim Covington for helping arrange this, organizing this, and bringing this important conversation to the Flynn Foundation Network. Thank you so much, Kim. And thank you for everyone for participating.
Bye-bye.
Bye-bye.
Bye. Have a great afternoon.